And more than anything, thank you so much for coming. Congratulations for attending. There's a lot of other things that you could be doing right now. And I appreciate you taking the time to watch this presentation. Excited that my passion really is about functional medicine. There's a chat on the Facebook Live, so feel free to go ahead and type anything in that you have questions on, and at the end of the webinar, I can do my best to make sure that I get those questions answered. So, but before that, even if you're watching this, please type in the chat where you're from. It's fun to hear where people are tuning in from and where I'm able to impact people even across the world. My first webinar I was able to do about 9-10 months ago. I had somebody on from Canada, so that was a lot of fun. So who I am, I'm Trevor Hausauer. I'm a family nurse practitioner. My practice is Valley Vital Medicine. I am married to my beautiful wife, Amy, and we have 3 kiddos. Our kiddos are 9, 7, and 4 years old, and we also have a English Cocker Spaniel. So they are my why. They are the loves of my life, and I love having them to be able to go home to in the evenings. A little bit about me. I grew up in a family with a brother who had some special needs. We spent a lot of time in the medical system and traveling around, going to the University of Minnesota, Mayo Clinic, and we really had a wide variety of experiences. As a part of those experiences, got to meet some really great people and some people that did not leave very positive impressions on us. And as I grew up, that really left a lasting impact on me. And when I got into college, it really made me wonder, like, what can I do to impact other people in a similar way, make their experience as positive as possible. And so ended up getting into nursing school and being able to get my nursing education, be able to get some amazing experience helping people in both the emergency room as well as the ICU. But while I was there, really we saw people who were, they had these chronic medical concerns, and something would push them over the edge where they would end up in the hospital, and it just was not the best of experiences or the best of situations for those people. And so as a part of that, it really made me wonder, what can I do to make those people's experience better? What can I do to try to keep those people out of the hospital? And so I started thinking about that, and really what came to mind then was being able to see them outside of the hospital. And I started working with or figuring out what's the best way to do that. And so I said, well, as a nurse practitioner in primary care. And so as I went back to school to get my nurse practitioner degree, learned a lot, and also became frustrated a little bit about, what is the best way to help these people? Is it really to diagnose their conditions, or is it about helping them make some diet and lifestyle changes and addressing underlying causes that can help keep them out of the medical system altogether? And really that resonated with me. So as we would go through some case studies and we would talk about, evaluation and treatment of patients, my clinical instructor, she would sometimes say, well, and sometimes I would think about this or add this, and that this was sometimes a magnesium or ashwagandha or rhodiola or some of those things that were not in the textbook. And it really made me wonder, well, what in the world are you talking about? And as I was digging more into that and asking questions, she turned me on to the Institute for Functional Medicine. And so at that point, I drink the Kool-Aid. This has become my passion. This has become my life. Um, I started my career in internal medicine here at Essentia in Fargo, North Dakota, doing primary care. Gained some incredible experience. But at the same time, it really didn't resonate with me. It wasn't my passion. It wasn't what I wanted to do. So I continued to pursue my education through the Institute for Functional Medicine as well as the Kresser Institute, and gaining certain certifications in functional medicine and furthering my education. So this has led to my starting my practice, Valley Vital Medicine. And I started this in July of 2019. And it's been an amazing and super fun ride since then. And I'm excited to share my passion for functional medicine with you today. And so I guess what I'm looking to do is really answer the most basic of questions. What is functional medicine? How is it different from conventional medicine? So before we start, let's talk through a couple statistics though. We are in the midst of the worst chronic disease epidemic in human history. 1 billion people suffer from diabetes or obesity. Obesity in adolescents quadrupled in the last 30 years. Almost 20% of kids 6 to 11 years of age are now obese. Almost 600,000 people die of heart attacks each year. 1 in 4 women and 1 in 6 men have an autoimmune disease. Greater than 50% of people take prescription medicines. 40% of the elderly take more than 5 medicines, and 90% of people take over-the-counter drugs regularly. Autism prevalence has more than doubled since 2000, and that's according to CDC. The number of people being diagnosed with depression increases by 20% each year, and I will be really curious to see how this COVID pandemic has affected that. Unless we change things quickly, things are going to get worse before they get better. Our kids are the first generation in modern history who will have shorter lifespans than their parents. If we continue on these current trends, in the next 2 decades, 95% of Americans will be overweight, and 1 in 3 will have diabetes. So what does all this mean? The consequences of this current health epidemic are profound. The cost of treating diabetes alone is $250 billion, a disease that is nearly 100% preventable. Let's compare that to a different number, 200 billion. That's the amount that the World Health Organization estimates that it would cost to end world hunger. So we can beat world hunger just by eliminating a preventable disease. So if healthcare continues to increase at its current pace, the US may be insolvent by 2035. And think about how much that spending has increased just in this last year with our current pandemic. But setting the pandemic aside, with this expenditure, we should have incredible healthcare. We should be reversing and preventing disease while doing minimal harm. But statistics show just the opposite. A study in JAMA in 2000 shows that medical care is the 3rd leading cause of death. And since only 5 to 20% of iatrogenic or medical staff caused events are reported, it could be the #1 cause. So why is our healthcare so ineffective? Well, I would postulate to you, it's not healthcare. A better description of our healthcare system would be disease management. So let's talk about conventional medicine here a little bit. The National Institute of Health defines conventional medicine as a system in which medical doctors and other healthcare professionals treat symptoms okay, listen to this, treat symptoms and diseases using drugs, radiation, or surgery. That's the definition from the National Institute of Health. So let's take a look at some of the similarities between conventional and functional medicine. They're both practiced by licensed medical professionals. They're both evidence-based, and they both utilize diagnostic testing. So let me clarify, make sure we get one thing right. I am not anti-conventional medicine. Modern medicine is amazing in many ways. It's incredible for emergency medicine and trauma. Our lifespan is longer than ever because of this. We can reattach limbs. We can restore sight to the blind. In our lifetimes, we might be able to fight cancer with nanorobots. But conventional medicine is not very good at promoting health or preventing and treating chronic disease. It's system focused on suppressing symptoms with drugs. If you have high blood pressure, take a blood pressure pill. If you have high cholesterol, take a cholesterol pill. Very rarely is there much investigation as to why these things are happening. No, there's definitely a time and place for medications, but some are better than others. And there's 4 fundamental problems with basing our care on drugs. Number 1, drugs rarely address the real problem. Think about this for a second. If you had a pebble in your shoe making your foot hurt, you could take Advil to reduce the pain, but wouldn't a better solution be to remove the pebble? I think so. Number 2, drugs don't just suppress symptoms, they suppress function. For example, many take NSAIDs, such as ibuprofen, to cope with arthritis or inflammatory conditions. It's effective for pain, but they also reduce blood flow to the cartilage. Blood carries all nutrients and immune substances for tissue repair. So, NSAIDs can therefore worsen your problem when taken chronically. Number 3, drugs often correct one imbalance by causing another or several others. If a drug interferes with one protein, it inevitably is going to affect many others. This causes what is referred to as side effects. Really, I think there's only intended and unintended effects. Often unintended effects outnumber the intended effects. Number 4, biological systems are redundant. The same molecule has many different effects in the body. Histamine is a perfect example. It plays an important role in inflammation in local tissues. In the brain, it causes functions of neurons. If you take an antihistamine to suppress an allergic rash, it also affects histamine receptors in the brain and causes drowsiness. My recommendation to you is that we consider a new approach to medicine, something that emphasizes healthcare over disease management. And what do we think that this new medicine would look like? The new medicine that I'm suggesting applies functional medicine approach to care. The best way to describe functional medicine is to contrast it with conventional medicine. So we're going to discuss that now. This is full disclosure. Some of these ways won't be fair, but we're just going to do this for the sake of conversation. So we'll be presenting a best case functional versus a worst case conventional medicine ideas. But as said before, conventional medicine is amazing for trauma, emergency, and acute care. But I think we all can agree that it's not real great at treating chronic disease, which is the number 1 problem that we face. So functional medicine is investigative. It treats symptoms by addressing the root of the problem. It leads to more profound and longer lasting results. Conventional medicine is oftentimes superficial. It masks or suppresses symptoms, but doesn't address the cause. It tends to create patients for life. For example, if you start on high blood pressure or cholesterol pills, most likely the doctor expects that you're going to take that pill for the rest of your life. Functional medicine is holistic. It treats the body as an interconnected whole. It recognizes that to treat one part, all of the other parts must be addressed. Conventional medicine is dualistic. It views your body as a collection of separate parts. You have a doctor for every part of your body. If you have stomach problems, you go see the gastroenterologist. If you have a skin problem, you go see the dermatologist. And oftentimes between these specialists, there's little communication or acknowledgement of connection of these different parts of the body. Functional medicine is quite safe. The treatments are typically have fewer side effects, risks, and complications. It emphasizes diet, lifestyle, some supplements, and herbs. Unrelated complaints oftentimes improve spontaneously. Conventional medicine can be dangerous. Taking drugs and surgery, serious side effects and complications to include death. This is evidenced by, as we discussed earlier, that medical care is the third leading cause of death. Functional medicine is patient-centered. It treats the patient, not the disease. It recognizes individuality of a patient. There's no one-size-fits-all treatments. Patients with the same condition may get different treatments. Conventional medicine is disease-centered. It treats the disease, not the patient. Patients with the same disease oftentimes get the same treatment, despite having differences and possibly different causes. In functional medicine, a patient is respected, empowered, educated, encouraged to be active in their treatment plan. In conventional medicine, all too often, the patient's opinion is often discounted or ignored. Little time is spent on education, and the patient oftentimes is discouraged into being active. They're told just to take their pill. Functional medicine is integrative. It combines the best of allopathic and alternative treatments. It doesn't exclude drugs or surgery if they're necessary, and it tends to focus on diet, lifestyle, supplements. Conventional medicine oftentimes is limited, relies almost exclusively on drugs and surgery despite their risks. Functional medicine is preventative. It's guided by ancient Chinese proverb that says a superb physician treats the disease before it occurs. Conventional medicine is reactive, managing disease after it occurs. It often doesn't intervene until disease has progressed to a point beyond no return. And unlike conventional medicine, functional medicine often focuses on identifying and addressing the root cause of disease, not just symptoms treatment. Functional medicine examines every factor, or tries to, involved in including symptoms. Takes into account genes, environment, and lifestyle factors to treat the cause of the disease, not just the symptoms. Functional medicine was developed based on the understanding of the importance of an individualized approach to disease causes based on evolving research in nutritional science, genomics, epigenetics, according to the Institute for Functional Medicine. At the heart of functional medicine lies the understanding that when the underlying causes are not addressed, problems can progress and worsen. Lifestyle factors such as diet and stress often are consequently lead to irritating, chronic, and painful medical conditions. I would suggest the body is well equipped to heal itself. However, a poor diet and excessive external stressors interfere with the body's ability to heal naturally. The following factors are what truly sets functional medicine apart from conventional medicine. It focuses on the cause of symptom treatment. It's a holistic view of the entire body rather than a collection of separate systems. It examines the body, mind, and spirit connections to determine both physical and emotional aspects of disease. It improves the body's innate healing ability, partners with patients, allowing both parties to actively participate in their treatment. So as I've just discussed, the goal of functional medicine is to determine the root cause of an illness or disease in order to treat the cause or symptoms, the cause of the symptoms. Functional medicine uses the symptoms as a clue to discover something that's hidden deeper. So do this for a second. Picture a tall oak tree and imagine what we see above the ground as the symptoms of disease. The extensive root system below the ground is less visible, but it is not less important. The roots symbolize the cause of disease that functional medicine takes into account, both the seen and the unseen systems of the body, in order to understand how everything works together. When it comes to chronic conditions, a systems-based approach is needed, but this can be a time-consuming process, which is why functional medicine is the preferred approach by a growing number of medical professionals. Functional medicine is a personalized healthcare treatment to treat individuals, not diseases. As each of us are genetically and biochemically unique, functional medicine supports the body's natural ability to heal rather than tackling disease directly. Research shows disease and illness is composed of a complicated network among various systems of the body. Functional medicine utilizes the science to understand the relationship among these functions and to help the body self-regulate and heal. Tapping into this natural ability promotes natural healing and even prevention of many diseases. Did you know that health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease? Functional medicine has been proven to help a wide range of conditions, which include cardiometabolic disease, such as diabetes, high blood pressure, and heart disease. Neurologic and psychiatric conditions to include depression, ADD, and migraine headaches. Digestive concerns such as irritable bowel syndrome, ulcers, chronic pancreatitis, acid reflux, and diverticulosis. Autoimmune disease such as rheumatoid arthritis, lupus, and celiac. Skin disorders such as psoriasis, acne, and eczema. And hormonal problems such as thyroid conditions, chronic fatigue, and menopause. The main goal is to repair and restore the body's natural ability to heal by restoring system balance. Since each of us is different, our care plans are unique. Care plans may include lifestyle changes such as diet and exercise, stress management tools, detoxification programs, nutritional supplements, botanical remedies, and prescription medicines. Each plan developed between a patient and a functional medicine health practitioner aims to restore the imbalances that are causing a specific condition or prevent chronic conditions from occurring in the first place. A study published in the Journal of Health Economics titled "The Value of Disease Prevention versus Treatment" found that the demand value of prevention always exceeds that of treatment. Disease prevention is the process by which anticipatory actions can be taken to reduce risk factors known to lead to specific conditions. Millions of individuals die each year from preventable conditions, including heart disease, cancers, chronic respiratory disease, stroke, and diabetes. Study published in the Archives of Internal Medicine reports significant results for participants following a combination of 4 different lifestyle changes. The study followed 23,000 participants who adhered to 4 behaviors. These were not smoking, exercising 3.5 hours a week, maintaining a healthy diet, and maintaining a healthy weight. These behaviors alone contributed to a 93% prevention of diabetes, 81% prevention in heart attack, 50% prevention of stroke, and 36% prevention of cancer. Another study published in The Lancet followed 30,000 participants across 52 countries. Similar results were reported with a 90% prevention rate of all heart disease and lifestyle changes. Now, these are just two examples of the ever-growing body of research on lifestyle changes and disease prevention. There's many factors that contribute to heart disease. While genetics contribute to some degree, many other factors are within our control. According to Dr. Mark Hyman, he says that genetics load the gun, but the environment pulls the trigger. Aspects such as high blood pressure, high blood sugar, or abnormal cholesterol are often contributing factors to heart disease. These are often treated with medications, however. Hyman reports studies have increasingly shown that treating these risk factors has only little benefit, or none at all, in comparison to lifestyle. Lifestyle changes are the most effective tool for preventing contributing lifestyle factors, thus significantly reducing the risk of heart disease. A note on medications. Now, medications certainly have a place. A study in the Nutrition Journal compared the treatment with statin drugs to a diet rich in viscous fiber, almonds, soy, and plant sterols for lowering of cholesterol. The study found similar rates of cholesterol reduction. However, the dietary changes also reduced inflammation and homocysteine levels. Functional medicine utilizes the following modifications for preventing and reversing heart disease in some cases. Eat your phytonutrients. Try getting 8 to 10 servings of colorful fruits and veggies to maximize your disease-fighting benefits that you get from vitamins, minerals, fiber, antioxidants, and anti-inflammatory molecules. We need to stabilize our blood sugar by incorporating small amounts of protein, healthy fat, and healthy carbohydrates at every meal. Get more fiber. The average American is only getting 15 grams of fiber per day. Work your way up to 50 grams by incorporating high fiber foods such as vegetables, nuts, seeds, and whole grains. Have you ever wondered why processed foods have such a long shelf life? Processed foods are packed with all sorts of chemicals and dyes that are lacking in essential nutrients. Eliminate foods that have hydrogenated fats, such as margarine, shortening, processed oils, and many baked goods, and processed foods like cookies and crackers. Instead, opt for foods with healthy omega-3 fats. Anxiety is a normal part of life. However, when anxiety doesn't go away, it can interfere with daily life. Conventional medicine approaches anxiety by balancing neurotransmitters in the brain. Functional medicine takes a look at root causes of anxiety. Let's discuss a gut pathology contributing to anxiety your functional medicine doctor may examine. Instead of suppressing symptoms through prescription medications, functional medicine examines the underlying cause, even if anxiety is caused by an imbalance in neurotransmitter activity. What is the cause of the neurotransmitter dysfunction? A functional medicine doctor may start by examining gut health. The body of evidence linking gut health and brain health has skyrocketed. In fact, this research goes back to the early 1920s. Gut inflammation, small intestinal bacterial overgrowth, and fungal overgrowth, among other issues, affect the brain. Additionally, serotonin, a key neurotransmitter, is produced in much higher volume in the gut than in the brain. Some doctors would even say that the gut is our second brain. It's recognized that dysfunctions in the gut can lead to a variety of cognitive, mood, and behavioral disorders, including depression. The link between nutrient deficiencies and disease cannot be overlooked. Your functional medicine doctor will most likely want lab work on your blood and urine nutrients to determine if any are low. B12, folate, zinc, copper, EPA, DHA, vitamin D, B6, riboflavin, they all play an important role in mental health and neurotransmitter activity. Shellfish and organ meats are the highest in many of these nutrients. Our skin is the largest and most visible organ of the body. But did you know that your skin can reflect deeper issues of health? One of the most common chronic skin conditions, eczema, is an inflammatory skin disorder that results in red, dry, itchy skin. Dermatitis is an acute skin condition with similar symptoms. Skin infections, on the other hand, can be caused by a virus, bacteria, or fungus. Some forms of viral skin conditions include herpes, shingles, and warts. Bacterial infections can spread to other parts of the body, such as cellulitis. Athlete's foot and ringworm are examples of fungal skin infections. Antibiotics are commonly used to treat infections. However, they can weaken the immune system and lead to chronic conditions when inappropriately used. So when treating skin conditions from the inside out is oftentimes necessary to address the root cause of the problem. Functional medicine treatments may include tea tree or coconut oils that have potent antifungal agents that can be applied to infected skin after showering. Witch hazel and chamomile are also great anti-inflammatories for acne spots. Apple cider vinegar can help with treating fungal infections. We can also consider ozone oil. If poor nutrition is thought to be the culprit, you can try ruling out common food allergies, increasing your intake of anti-inflammatory foods, which are high in vitamin C, bioflavonoids, iron, carotenoids, and vitamin E. Stay hydrated with water. Avoid processed foods that are high in sugar. Functional medicine can help through various outlets. First and foremost, by addressing the underlying cause of stress. Diet, exercise, and relaxation techniques can also be used. Cortisol is noted as a potent stress hormone and has been associated as a major contributor to a number of chronic conditions. While cortisol plays an essential role in circulatory function, excess levels can be deadly. Many studies have examined the relationship between stress and health, and the results are quite alarming. Some well-documented negative health results of stress include damage to your immunity, increased risk of diabetes and obesity, and poor cognitive function and focus. Functional medicine can help through various outlets. First and foremost, by addressing the underlying causes of stress. Diet, exercise, and relaxation techniques should all be used. Your body already houses a number of detox methods. Through functional medicine, you can aid this natural process. The liver, for example, is the major organ of detoxification. When the system becomes overloaded with toxic agents, they can accumulate and get trapped in the body. The purpose of a detox program is to reduce the burden of being overactive from the liver and digestive system by allowing it time, anywhere from a week to a month, so it can rest and once again function optimally. Additionally, it is important to support the detoxification pathways with the proper and necessary vitamins, minerals, and micronutrients. Your functional medicine practitioner may help you determine which foods to avoid that are causing excess inflammation in your body. Now, many patients wonder all the time, if they can get all of the nutrients they need from the diet alone. Ideally, food would provide everything we need. However, there are several factors causing diet alone to not be enough. For example, depleted soils, the storage and transportation of food, the genetic alterations, all impact the nutrient content of everything we eat. Examples of conditions requiring additional supplementation include obesity and diabetes. Both conditions are a result of malnutrition. Essential vitamins and minerals are needed to restore the balance in the body's functions. Specific supplementation measures will be discussed between you and your functional medicine practitioner. Depending on your current state of health and healthcare goals, supplementation programs will differ. This is the wonderful thing about functional medicine, since there is no one-size-fits-all approach. Every level of care is developed specifically for you and with you. So when visiting a functional medicine practitioner, you can expect your visit to take a little bit longer than it would when you go see a conventional practitioner. Functional medicine practitioners are looking for in-depth information regarding your personal and family history and the circumstances around your symptoms, as the goal is to uncover the underlying causes of your health in the first place. A detailed history, physical exam, lab tests are all necessary to provide the full picture. This may seem like an initial investment, and it is, but it's worth your time to get to the cause rather than treating symptoms, which can lead to recurrent conditions. The Institute for Functional Medicine suggests a list of questions to ask practitioners to get the most out of your experience. Remember, the functional medicine process requires you to be an active participant in the problem-solving process. Some of these questions would be, how would you describe your practice? Do you work with other clinicians? Do you have information you could send me about your practice? Do you have experience treating my condition? What are the main therapies that you use? And are they covered by insurance? So I will just take a minute to answer some of those questions for my practice. My practice is Valley Vital Medicine here in Fargo, North Dakota. My practice really focuses on a few things. We focus on gut health, focus on fatigue with adrenal and thyroid problems, we focus on metabolic problems with diabetes. Also focus on pain and doing pain treatments with ozone, PRP, stem cell injections. Also do some ozone treatments and other IV vitamin infusions as needed. I also have a very special and specific test that I use in my practice called bioenergy test. Bioenergy test is quite comprehensive, where we do a bioimpedance analysis where we measure your body fat percentage and see how well hydrated you are. Get a blood pressure laying down, standing. We do a resting metabolic test where we see how many calories you're burning in a day, how well your thyroid's functioning. Also then have you get on an exercise bike. And you only exercise for anywhere from 6 to 9 minutes usually. But what we're doing is we're exercising you to the point of where you're not able to use oxygen well in your cells any longer. And then we have you do a breathing test with a spirometer. Gives us an idea of how well your lungs are functioning. Now, the point of this test is to see how well your mitochondria are functioning, how well your cells are functioning and producing energy and using oxygen. Can help us get an idea of where you're at just overall health-wise. How are you aging? How many calories should you be eating in a day? How many carbohydrates are you eating? Are you eating too many? Helps give us some ideas of how you should exercise. If you exercise too hard for too long, you're actually doing yourself a disservice and you're creating extra inflammation in your body. We can help give you exact heart rate parameters of where you should be exercising. Seen too many overweight people going out and exercising hard, and they're exercising more than they think that they should. And chances are they are. They're causing more problems and more inflammation in their body by exercising too hard for too long. So the bioenergy test helps us get some answers as to where we should be with our exercise. And how well are we aging compared to other people? If you're interested, you want to see some references in regards to this presentation, please let me know. I'm more than happy to discuss those with you. But more than anything, thanks so much for joining me for this webinar today. I hope that it has provided you with some useful information and that you may feel ready to schedule an appointment with a functional medicine practitioner. If you're wondering where to find one in your area, you can always check out the Institute for Functional Medicine website, ifm.org. If you're interested in working with me here at Valley Vital Medicine, I encourage you to check out my website. My website is valleyvitalmedicine.com. And you can spend some time looking around on my website, some of the different services that I offer. If you're interested in working with me, I encourage you to click on the button in the upper right-hand corner that says Work with Trevor. And when you click there, there's a couple things that it has you do. One is to register to complete a short health assessment. This shouldn't take very long. Now, you do have to be on an actual computer to do this. Unfortunately, that system doesn't cooperate with phones. But filling out that health assessment is super important and helpful for me when we're visiting. The other thing that you can do at that link, on the Work with Trevor link on my website, is register for a free discovery call. This is where we visit from anywhere from probably 20 to 30 minutes. We talk about what your concerns are and what a functional medicine evaluation would look like for you. If you think that this is something that would be helpful or beneficial for you, I would love to discuss that with you. So please feel free to jump on and to check that out. If you have any questions, please feel free to email me. You can email me directly at trevor@valleyvitalmedicine.com and be more than happy to get back to you with whatever questions that you have. So I'm going to stop my recording here for a minute.